We're taking your medical questions today for this guy, Dr. Zorba Paster.
Hi, Zorba, welcome back. It's a good day to call. There's, let's see.
3 lines open.
3 lines open at 608-270-9933.
Why do you always put your cell phone number up there?
I know. I accidentally put it in the teleprompter.
270-9933. Interesting study out of Europe about colonoscopies.
Right, and it showed, this particular European study showed that we may have oversold colonoscopies as actually reducing cancer significantly. On the other hand, when you look at the data shows for those people who opted to get a colonoscopy, there really was a significant reduction in death from colon cancer. But when you looked at the entire trial, because more than half the people did not get a colonoscopy, that data was a little bit less. Nonetheless, it's only one study, and Europe may be different from the U.S. And let me give an example. In Norway, esophageal cancer is very common, not as common as in the U.S. In Japan, it turns out that stomach cancer is common. It's not as common as in the U.S. So what we eat may actually affect how much colon cancer we get. And when you're looking at Poland and Romania and the other Europeans, they may not get the same type of colon cancer. So I think there's a lot to be said. Nonetheless, I still think we should get screened for colon cancer.
Absolutely.
Yeah.
All right, should we get to the phones?
Yep, let's go to Tom in Chaupier. Tom, go ahead.
Yes, how long does the flu shot remain effective?
Well, we pretty much think it remains effective during the entire season. And my recommendation to people is get your shots before Halloween. Get your flu shot before Halloween, get your COVID shot before Halloween. And I think pretty much, at least moving on into the future, there are going to be yearly COVID shots and there are going to be yearly flu shots. And I want to say something else that's interesting about COVID. During the height of the epidemic, 50% of the deaths occurred in people under the age of 65, okay? 50% of the deaths. During COVID, 90% of the deaths occur in people over the age of 65. So it's people over the 65 who are still, at this point, the most likely to die from COVID. And if you know somebody over the age of 65 who didn't get their primary series or their booster series, kind of try to talk them into it. I mean, I think the politics around COVID has decreased quite a bit, and you can often now give people a good idea to give the shot, and they may say, okay, I'll get it.
Can you get them both at the same time?
You can get them both, and I got them both at the same time because, frankly, you get a better immune response if you get them both at the same time, and the side effect profile is really pretty much the same.
All right, very good. Let's go to Janelle in Juneau. Hi, Janelle, what's your question?
Hi, my question is in regards to a colonoscopy prep. Can't they come up with something better than that awful stuff?
That'd be great.
I think a lot more people would get it.
That's right.
Get a colonoscopy.
That's right. That's right. From your mouth to God's ears. That's right. We have to have a better prep. There is an alternative prep. It just doesn't work as well. Our colon kind of wants to hold on to its poop. And so that prep is to try to get everything nice and clean. Yes, I wish they could get one. Let's not forget that Exact Science, of course, has Cologuard. And for people at low risk, you don't have to do the prep. And if you're at low risk, I would recommend that you get Cologuard because you don't have to go through the prep. You don't have to take off from work and so on.
Okay, let's go to Marilyn in Stoughton. Hi, Marilyn, go ahead.
Hello?
Hi, Marilyn, go ahead.
This is Marilyn from Stoughton.
What's your question?
And I would like to know if I could have 2 shots, like one for shingles and one for the flu.
Well, I don't know. We have to look at each individual shot. I can't tell you if shingles and the flu can be given together. You've got to call up your doctor and ask because some shots can't be mixed. But you can get COVID and you can get the flu shot at the same time. I'm not sure about shingles.
Shingles is a live virus.
It's a live virus, different issues, so I don't know if you can get them at the same time. Call your doctor's office for that.
Okay. All right, let's go to Lori in Beloit. Hi, Lori, what's your question?
Yes, I had COVID last week, and I was wondering when I could get my second booster and my flu shot.
Anytime at all. You don't have to wait. According to the CDC, you don't have to wait. Once your symptoms are gone and you feel okay, that's fine. If you want to really be super conservative, then wait 10 days from the onset of your symptoms, and that will be assured. But the CDC says you really don't have to wait if you feel okay.
All right. Let's go to Shirley in Stoughton. Hi, Shirley. Go ahead.
This is Shirley. I wanted to ask Dr. Zorba about my itchy eyes. I've been to several eye doctors, and they don't seem to help me. I do have dry eyes, and I use drops 4 times a day. but
So I'll give you a tip for itchy eyes. And this is from Dr. Kellogg. Old Dr. Kellogg, I was a partner with him, World War II veteran, Korean War veteran, started practice back in the 50s. And he always said, wash your eyelids with a little warm water and a few drops of Johnson's baby shampoo. And that will often stop all the itch and everything else. So it's an old doctor's, he's now gone, it's an old doctor's folk remedy. So I would recommend trying that if new doctors, modern doctors can't do it.
Well, those kind of remedies are always work. They
That's
always
right.
do.
You got it.
You
You
didn't
think
die of
maybe
an eye problem or anything, did you?
Yeah, no.
you think maybe it's just allergies? Because there's so much.
Who knows? A lot of things it
She's
could
got
be.
dry
You know,
eyes, yeah.
you know.
Yeah.
But who knows? You know, you just try the old remedy and see if it works.
Loved it, yeah.
Clean eyes, at least. Thanks for calling in, everybody. Zorba, good to see you
Great
again.
to
Good to see you
Zorba.
guys.
A final check of your forecast coming up.